Let's talk now to Marcus Plescia. He's Chief Medical Officer at the Association of State and Territorial Health Officials. He joins us on Skype from Charlotte, North Carolina. Marcus Plescia, welcome to the NewsHour. Is the central allegation here, or the central suspicion, because I don't want to push you into saying anything that's strictly speaking illegal, is the central suspicion here that the company knew it was addictive as soon as it started the process whereby the drug was prescribed to people?
Yes, I think that's the basic premise of the legal actions we've taken. And, that has been a concern, that the information that was provided about this medication really was not accurate. And, many providers, healthcare providers, physicians, other clinicians acted based on, misunderstanding or misinformation about the medications, and particularly this issue of whether it's addictive or not. I mean, these medications are clearly very addictive, but there was early communication that they were not, particularly for people who were suffering from pain.
At point of delivery or point of contact, why did the medical world, or why did state government or a federal government not get involved in this? I mean, clearly, if somebody goes back to their, I would say GP, but goes back to their pharmacologist or their doctor and says, I really need this drug, at some point, surely, there must have been a doctor-patient conversation where the doctor might have thought, this person is addicted, and that's clear to me as that person's doctor. Why did nobody raise the alarm bells sooner than the alarm bells were raised?
Well, actually, the medical profession and state governments, and to some extent the federal government, have been reacting to this problem for quite some time, for probably a decade or more. One of the early things we did was put into place monitoring systems so that you could go online. If you're a clinician, you could go online, and when somebody is requesting pain medication, you could check to see when they last got pain medications. So this practice of shopping around and going one place and another to get the medications could be stopped. Many of those systems were built, a decade or more ago. So we've known about the problem. I think we've also done a lot to educate physicians over the last decade. So there have been actions, but there's not been anything as significant as these legal actions and these liability suits. And hopefully these are the kinds of things that clearly puts this particular practice to an end, but also hopefully discourages it in the future.
What does this tell us about this specific drugs company and about the drugs company business in general in the United States?
I think it's part of a pattern that we've seen for decades now of, how pharmaceutical companies market and advertise their products. And I think what it tells us is we really have to be attentive to that, and we have to set some limits on how they advertise, what kind of access they have to the medical community, and what kind of information they're putting forward. And we have seen that improve. I mean, the access that the pharmaceutical industry has to medical care provisions has changed dramatically since I started my career as a young physician. I mean, and that's been a very, very good change. And some of that comes from society. Some of that comes, I think, from the medical profession stepping up and realizing this is not the way that professionals can behave. Some of the sort of gift giving and really kind of lavish encounters between clinicians and pharmaceutical representatives, that's been put an end to. But I think we need to continue to be really cognizant of that and take steps to continue to have a bit of a barrier between the folks who are marketing these drugs and the professional people whose job it is to prescribe and monitor them.
As you're talking to us, Marcus, we're looking at pictures of people protesting, I suspect, either outside Congress and or outside the this particular company's head offices, perhaps, trying to raise awareness of what they've experienced, what they've witnessed when it comes to family and friends. So we're seeing questions in Congress today in real time. This may yet go to a legal case. It may go to a class action. We've been hearing that as well today. In a perfect world, what will be the outcome of this when people have got compensation, when they remember the people who've died? What will be after that?
Well, I think potentially the greatest benefit of a significant civil action, and particularly if the judgment on that were severe, it raises the liability. It makes it very clear to pharmaceutical companies that there could be significant liability if they're not careful with how they market and communicate about their drugs. So although I think it could be beneficial to people to have some kind of compensation for the suffering they've had, I suspect most of these folks are motivated by the idea that they want to have a significant judgment that would discourage this kind of behavior from corporate entities in the future.
An important story that needs to be told. Marcus Plescia, thank you so much for joining us here on the NewsHour on Al Jazeera.